If kids have airway issues such as snoring, right? No kid should snore. If they have issues with their tongue, if they have issues with behavior, even ADHD. They did a study years ago that said 80% of kids with ADHD could effectively have their ADHD treated through airway solutions. I mean, that's crazy.
How early would you recommend that parents go see an orthodontist to check airway and all that kind of stuff?
We say at least by 7. And I think some parents at 11 or 12 feel guilty for not having brought their kid in at 7. It's all good, right? Yep. It's never too late, but we like to see them by 7. And the reason for that is it's more than just like teeth and more than just straightening teeth. There's so much more we can do as orthodontists. And really what that comes down to is like we can really shape faces. So if we want to maximize profile aesthetics, function and health, which I think go together, typically things that look good function well. And the opposite's true too. So a lot of that starts with early development. So if there is some abnormality and we see the patient young enough, we can correct those things pretty amazingly. Whereas if we wait till they're 14, 15, 16, or even further, we're left with compromising things, right? We're left with camouflaging skeletal issues, or we're left with using more invasive techniques. So if we can see them earlier and correct those things, boom, they can go live the rest of their life and enjoy the health and function and aesthetics.
Thank you for listening to the Generational Health Podcast. Today, I had an opportunity to sit down with Dr. Trevor Nichols. He's an orthodontist here locally in the Gilbert, Queen Creek, Arizona area. We talked a lot about oral health and the oral function and the different ways in which that can affect longevity, behavioral issues, development issues in both adults and children. We also just talked about life, talked about relationships, managing our time. It was really just a great conversation. Anyway, I think you'll really enjoy it. As always, I want to thank our main sponsor for making this possible. That's Hiva Health. You can check them out at www.hivahealth.com. They do everything from hormone replacement, medical weight loss, longevity, peptide treatments, and supplementation. So if you have any interest in those things, please give them a look. And as always, thank you again for listening. Awesome. Well, Dr. Nichols, we're live. Thanks for coming in, man.
Thank you for having me, man.
Yeah, it was really nice to talk to you on the phone. So Tyler hooked us up, got us connected, and after my conversation with you, I called him and I just said, I feel like Dr. Nichols and I know each other really well. Because when we were talking, we know a lot of the same people, and you made a comment on the phone. You said something like, I feel like we know a lot of people. We should know each other. But anyway, you asked me a million questions about myself. I could barely even get in a question about you. So I could just tell you're like a good conversationalist, probably have a ton of friends. You're just a good, I'm sure you have a lot of good relationship skills. So anyway, I'm happy to have you on here. I'll give you a chance to say your background, but you're an orthodontist here. And I think there's just going to be a lot of cool information we can talk about. You're also super fitnessy because you're ripped, I can tell.
Dude, look at you.
So we'd just love to learn a little bit about what you do and who you are, and some of the health and generational aspects of kids' dental health and dental function and all that kind of stuff that we could get into as well. So
awesome.
But I'd love to just learn a little bit about who you are, where you're from, family.
Yeah. Right on. So thanks for having me, by the way. I look up to you in a lot of ways, all the ways I think, but I love what you're doing for people and your passion. But so I grew up here in Arizona. I went to Red Mountain High School, like Northeast Mesa. So go Mountain Lions. Played football, ran track, was a big athlete growing up. I have a twin brother. He's in pest control, works for Moxie Pest.
Okay.
Doing great things there. And then I have a sister, and she lives in California. She just finished Chinese medicine school, graduated last weekend. So went up to see her.
That's who I saw on your Instagram. Okay. I was wondering.
Amazing.
Okay. That's
amazing
your sister.
Journey. Yeah.
Very cool.
So great things for her. So been here pretty much ever since. So I assumed that I would probably leave for dental school and residency, but I went to ASU, did my degree in exercise science because it was something that I love. Well, I did my prerequisites for dental school. Went to dental school at the Arizona School of Dentistry and Oral Health, which is in Mesa. It's it's off of Recker Road, Recker and Baseline. and spent 4 years there doing my doctorate in dental medicine, and then did my residency there in orthodontics and craniofacial orthopedics too. Big emphasis on like temporomandibular joint dysfunction and stuff like that, and started practicing in Mesa, and was with a partner for about 7 years or so, and then left a couple years ago to kind of do my own thing in our offices in Queen Creek. I love it. Ortho's probably, I have a lot of passions in my life, but I think for me, it's ortho for sure. It's family, it's faith and fitness. So those are kind of my four things that are probably the biggest dedications of my life. And I think one hard thing for me and probably for most of us is like, does balance really exist? Is it a real thing? Mm-hmm. And I think it's almost like we're all spinning plates and we focus on the plates that need the most attention at a time. But one thing I think that I just have found for me is ortho is not only my passion, my career, but it's also like my favorite hobby, So I'm blessed to have a career that I'm passionate about. When I think of my own kids, I think my biggest wish and dream for them is that they can find something they're passionate about, because I think it brings fulfillment and joy, especially in the service of other people, right? It brings fulfillment and joy. And at the same time, typically things you're passionate about, you're good at because you like doing them. And typically you like doing things you're good at too. So it's been an amazing ride. I feel like I'm just getting started, but I have a lot of great goals to just really improve people's lives. And I think the three things I really like to focus on there is really improving people's confidence through the aesthetic transformations. And then of course, improving the function and health of their bite, their mouth. But the aesthetic stuff is really interesting for me. And I've seen the power of what it can do for people and how they do things after treatment that they wouldn't do before. Because your smile is like your brand. It's your identity. It's your icon, your logo. And, for people that haven't had confidence there for a long time, it's emotional, it's intimate. And that's probably the favorite part of what I do.
Oh, that's cool. Yeah. So what got you interested in studying dental in the first place?
Yeah. I've always been interested in medicine and was kind of going back through like, did I want to go to medical school or did I want to go to dental school? And I shadowed a couple of physicians and a couple of dentists, and I just felt like it was right for me. I almost feel like it was a calling for me. Like there was no doubt in my mind when I kind of explored the path that like, this is what was meant for me, like even divine calling. And I've seen that kind of play out. Things have been put in front of me that there's no doubt in my mind that it was like divine intervention. Like this is something that was meant for me. And I believe personally that, God uses people, right, to bless the lives of his children. And that's how I look at this. I pray for my patients every day. I feel like it's an honor, an obligation, and a calling to like serve them the best that I can. I'm not perfect, but for me, it's about effort more than it is perfection. If I can give them my all, then things work out, genuinely. So I just felt like it was a good mix of medicine. I love art. I've always been really into art. So kind of a great blend of like art and medicine, also with like the component of just serving people, which I think always brings happiness.
Yeah, that's cool.
Yeah.
Yeah. I look at orthodontists kind of as artists. I've seen that. I've seen other, I had another orthodontist in here just a few weeks ago, and he's also artistic. I've noticed he's like way into photography, and he just like stuff like that, so maybe there's a bit of a correlation there.
Yeah.
And also really cool that you found something that you're not only passionate about, but you just like love doing it. It's really hard for a lot of people. I think there's so many people that are stuck in jobs, there's a lot of, great things about people who are just working hard to take care of their families, even if they're in something they don't love. But really cool that you have been able to find your way into something that's highly impactful, that brings a lot of happiness to people. But it's also something that you genuinely love doing. So
yeah, I feel like
pretty cool.
That's a huge blessing. And I've seen that too with my brother when he was trying to find his career path. He did a master's in business, and I could tell he was kind of exploring for what would match or best fit him and his passion. And I saw that be difficult for him. So I saw it as a blessing, where it was like, hey, I knew what I wanted to do. It was like, just put my head down and get it done. And I feel like that could be a struggle for a lot of people. And it's hard, to find that. And I think you have to explore it. You have to intentionally go out and look for things and explore things to find that passion, to kind of ignite that fire. And then it's like dumping fuel on the fire every day to try and reignite that or build it. Mm-hmm. And we have to do that constantly, right? With what you do, with what I do, we have to continually like stoke that fire to make sure that we're doing it for the right reasons day after day.
Sure. So you are also super fit, sounds like fitness is one of your 4 pillars.
For sure.
So have you always been that way? I mean, you said you played football in high school. So when you went into college and you got your doctorate and then you specialized in orthodontist, that's a lot of schooling. And I also did a decent amount of schooling, which can take a huge toll on your time, mental capacity, energy, all that kind of stuff. And then it sounds like you started with a practice for quite a few years and now have started your own practice. It's a huge time commitment. So would love to know a little bit about your routine. What do you do? How have you stayed consistent during all of that? Were there times where you slipped and, I don't know, just anything in there would be really interesting to know.
Yeah. I think another thing I've been blessed with either through my upbringing, through my parents or whatever is I just love hard work. I really do. And I'm a very disciplined person. It's just whether that's by nature or something that was created in me, I don't know. It's a little, I feel bad saying it, but for me, it's pretty easy. And I just have my goals and I go do it. One of the mottos that I try and live by is the way you do anything is the way you do everything. And so for me, gym stuff has always been consistent. I think I started like Olympic lifting when I was 14, and I've probably worked out 5-6 days a week without fail for 20 years. And for me, it's a mental thing too, right? It's like, there's nothing better than getting out of bed and doing something hard to start your day. And the physical aspect of it too, it does bring me confidence. I think that, we want to be the best version of ourselves. And it's unfortunately, it's never really enough for most of us, right? Even for me at the gym, it's like never big enough, never cut enough. And I think that that's maybe even a problem for me, right? But it also is like a good mental release, and it's a bit of therapy for me where that's something I can control. A lot in life we can't control, but I can control what goes in my body. I can control what I put out at the gym. And so having that control gives me some peace, I think, and helps me kind of release the things that aren't in my control. And so for me, it's been kind of a mental stabilizer. And I just really enjoy it. I love pushing myself. I love the game of like testing your body and like building things and sculpting things. And so for me, it's always been a huge passion and I love it. And I hope that my kids will like it too. They don't have to be as crazy as I'm about it. And I hope that I'm not like making them think they need to be, but obviously having great physical health is going to help us have good mental health, but even more so just good quality and longevity of life. And for me, I found that it does that and more, even with the confidence, like I said, because we all, again, we want to look good. We want to do our thing, but we want to feel good too. We can't do that without good exercise.
Yeah. The gym is kind of, I'm similar. I think going to the gym is not that hard for me because I enjoy it. I really do enjoy going. There's parts about it where it gets tough, but there's kind of some level of enjoyment in pushing through the tough as well. But I'd say more than anything, it's a mental thing. Yeah. Like if I don't go and I take it off, or I don't know, I just feel like it's kind of my day's a little off. Yeah. I'm not as sharp. So I almost feel like I have to have it as part of my regimen. Otherwise I'm not going to be as, and sometimes we have poor sleep or whatever. And the next day, it's just the day's not going to be as good as it could be. But the gym always tends to be a bit more of a mental thing for me, where I feel like it's the only time. I'm not really big on working out I've never been good with like group fitness or working out with partners that much, because I kind of need the headphones and my alone time a little bit. Even though like if I'm at home visiting family, I love working out with my dad. Like love it. He's still super active, and that's one of my favorite things to do is spend time with him at the gym. That's awesome. Just because we can, But if I'm at home in my normal routine, I'm generally a lone wolf. I like to just at home, or you? No, I'm at Mountainside down here. So yeah, but I kind of do it myself, and I throw the headphones in because for me, it's the only time I feel like that I'm kind of alone during the day. Yeah. And it's the only time I can sit and think or prepare for conversations like this, where I'm like, okay, what do I want to talk to Dr. Nichols about? Sometimes I'll go back and listen to other podcasts that you've been on or others and just kind of get a feel for, it's a time for me to learn. It's a time for me to just kind of like put stuff off. Sometimes I just listen to music and just go hard and not think about anything and just be in the moment too. So for me, it's just a mental thing. I love that. Yeah. And I guess for me, it's the same in my routine. It's like you, it's even if we're out of town, my wife knows like I need an hour.
to do my thing at the gym, or I'm going to be off for the day. And I don't know if that's a healthy or unhealthy thing, but I just know what works for me. And same for you. It's like some days I'll listen to podcasts, other days I'm just cranking music. But I also have found that some of my best friendships have come from the gym. And I'm not like one that sits and talks all the time, right? I think you're like me. It's like we're on a time crunch every day. We got schedules that are busy, but I've met some amazing people there. And I think there's camaraderie there in doing hard things and pushing ourselves physically that we want to push ourselves mentally. So I like to go early. I typically wake up early. I'll do my gym thing. I do a little spiritual stuff in the morning too. I typically do about 15, 20 minutes of something spiritual, typically right when I wake up, try and connect myself to God and my spirit. Then I'm at the gym for typically about an hour. I try and get to the office about 30 minutes early to prepare for the day. I try and do a little bit of leadership with the office every day. So Mondays, I'll bring an inspirational message that is more personal development. And it's typically things I'm learning and working on myself. And I'm very vulnerable with the team and things I'm working on, my struggles. Tuesdays, we do a book club. So right now we're reading a book called Be Amazing or Go Home. It's amazing. It talks about us just instilling confidence in the people that we work with. And so then on Wednesdays, we do kind of some team building stuff. And then on Thursdays, we will pick someone in the office that did something amazing that week, and we'll highlight that person. And we talk about, hey, Colby did this for me, and it was an amazing opportunity for me to go and share a little bit about myself. And that made me feel important, and it made me feel valued, and it could be something they do with the patient, and that just builds and brings us together. And so I spend a lot of time on that, just trying to develop myself as a good leader, because I found that in any business, I'm sure, but for me in the practice of orthodontics, it has to start with us. And I really want people to feel that we genuinely care. And so if I don't do that with my team, then they can't do it with our patients. And we have to take time to train. We do every Thursday from 2 to 5, which is prime time hours for ortho. We take off and we just train on anything and everything to help our patients have better experiences. We focus on 3 big things too. You talked about pillars. Our 3 big pillars are patient experience, culture, and results. We talk about that every day and how we can do that better, and then getting good, constant, and consistent feedback to improve our process to just give people our best.
That's awesome. That's very cool. So all those things, the book club, all that's with your team at work? With
my team at work every day. So we will meet for 30 minutes as a team and discuss all the things we talked about. And then I also do, after that, we do a 15-minute kind of like a huddle with a clinical team, and we talk about all of the cases that are starting that day. And the team will actually present the case to me and say, hey, this is Heston. Heston's coming in today with XYZ. These are his goals. We actually talk about the case together and our goals, our plan. I'll ask them questions because I want them to be like mini orthodontists, to where that they can answer any question for the patient. They're looking at things and helping me with things so that we can have the most efficient and effective result possible, because no one wants treatment, especially adults. And we have a lot of adults in our practice. No one wants to be in this more than a year, whether it's aligners or braces. Like, you have a time frame where you got to get it done. So we have to maximize that. So I really enjoy that too. The teaching component of ortho for me has always been really fun. And I think for me, I love to teach, but also, as you know, we get more when we teach. And it helps me kind of hone in my process, and also helps me evaluate what I'm doing, things that are going well and things that aren't going well, so I can consistently improve. And like you doing this podcast, like, life is about relationships and improvement. If we're not building our relationships and cultivating good relationships and growing, I think we're missing out. I mean, that's what we're here for, right? Is to establish great relationships with people like this, and then to just grow and create. And I think that also brings us fulfillment in anything that we do.
And that's cool. You mentioned that in your morning routine, you spend 15, 20 minutes on a spiritual, kind of on some sort of a spiritual aspect to get the day started. Why is that spiritual piece important for you?
Yeah, I've always had faith, I think, faith in God and faith and the destiny. And I think in decisions that I make, I need some guidance there. I mean, life is hard. Without some guidance, I think we're all lost. And so I feel like I need to maintain some proximity to that spiritual side. I need to maintain proximity to God and my relationship with Him, or I can't know how to listen to Him best. If I'm not picking up the phone every day and asking questions, and I just leave the phone away, I can't listen to what's happening. I can't get guidance. And especially when I feel like I do count on that for even some of the clinical things that I do, if I'm not in tune with that, I don't feel right. And there are days I don't have time for it, and it affects me sometimes where I'm like, dang, I didn't get that, or I feel a little bit distant. And so that's been an important part of, for me mentally too, is like, I kind of have to check the boxes of the things in my life. Is my relationship with God, how am I doing in that? He's always there for me. Am I there with him? Same thing with my relationship with my wife. I mean, stuff gets busy, right? And I think that we tend, probably like you and most guys, that we're trying to hustle, right? It's hard to decide, do we put the time in now and sacrifice now to enjoy the benefit later? Or is it worth that sacrifice? Are we going to look back 5 years from now and be like, it wasn't worth the time I missed for my kids? And that's really hard. It's hard to know. And so I try and listen to the needs of my wife and kids. My wife and I have an amazing relationship. Best part of my life by far. But she comes before anything, even my kids, right? She comes before work. She comes before the kid stuff. And I've got 4 boys. So I've got twins that are 13, and then I've got a 10-year-old and an 8-year-old, and they're so much fun, but they're demanding, right? When I get home, it's like, dad. And I love that I'm their hero now. And I honor that, because I know that may not last forever. And even the stuff that's hard, I try and remember I'm going to miss the hard stuff too. And so I try and check the boxes as best I can. And there's some days I fail, right, in the 2 boxes, and I try and do a little bit more the next day. But I think that's the constant struggle of life that we have as dads and husbands and business owners, is you can't do everything perfect all the time. And I think we give ourselves guilt for that. I certainly do, where it's like at the end of the day, I'm like, I did this, but I didn't do that. And I think we have to try and find peace in our efforts and know, especially in orthodontics, that it's our practice, not our perfect. And life is about practicing good things, but not being perfect, but just striving to do the best we can and being at peace with, hey, I gave everything I could today. I'm going to try again tomorrow. And the blessing is that there is another day, hopefully, right? But having peace with us, just doing the best we can.
Man, you got a really cool routine. I'm not as disciplined as you are in a lot of those ways, and I probably need to step it up. But, health is kind of it's so broad. Like, we can sit here and talk about physical fitness. We can talk about mental health. We can talk about spiritual health, emotional, relationship health. All of it requires kind of the same regimen, and it's hard work. I mean, you got to work on it. You've got to push yourself so that you can grow. I mean, that's the only way any of those things work. And if you neglect one, it's, that muscle is going to start to atrophy, whether it's your spiritual or mental well-being. And, you and I are busy dads. I've got 4 boys too, 1 girl as well, but no twins. And, I run a business and all the other sports and activities. And like you, my wife is by far the best and most important part of my life. And, at any given moment, we can neglect one of those things. And so it's your routine in the morning is really pretty impressive to me, because it helps you kind of stay focused on all of those at the same time. And that's really tricky to do for almost everybody. Yeah. Some people are really good at one thing, but they're neglecting all this other stuff. And that tends to be pretty common, especially with business owners and others that put everything into growing something spectacular over here. Meanwhile, they've sacrificed really important relationships that are arguably the most important over here. They're probably doing all of this over here for that over there, but neglecting it has made it atrophy, and it's made it weak, and it's made it vulnerable.
It's easy to do too.
Yeah.
It's so easy to do. And I think we all get trapped in that from time to time. I don't want to give the illusion that I'm perfect with any of that, because I'm certainly not. But I found that if I can check those boxes, I feel more at peace. And even if I'm lacking a bit in one area, I try and just be intentional. It's little things too, like writing a little note to my wife in the morning. Like, those little things, they do a lot for our relationship. And I think just taking a little time to send a text to somebody, or to do a little bit more, and just listening and being aware and trying to be intentional can be helpful. But gosh, there are days I look back and I'm like, dang, I didn't do it today, and I think that's natural, right? But again, it's to not let it slip and say, okay, well, we're going to get back on the horse and go again. Because I think a lot of times we fall off, we guilt ourselves and say, well, then I can't do it, and I suck. And we start like self-deprecating instead of cheerleading for ourselves. Yeah. And we're sometimes we should be our own best friend, but we're our worst enemy. We'd say things to ourselves we would never say to our friends. And that's a journey too. All of us have, I think, moments of self-doubt, and especially imposter syndrome as we're starting businesses. It's like, can I do it? Or do people really want to come see me? Even though I want to give them my best, is that enough? And I think that we all have to go through that journey, and some days are harder than others. Some days I'm like, dang, I'm not there. I'm not enough. Other days I'm like, okay, we're doing great things. But we have to try and find that peace in the journey, I think, and knowing there's going to be ups and downs and riding the highs. And when there's low times, that's going to happen. Sometimes it's just putting the next step forward, and just getting through the day, and looking for the light that's going to come in a couple of days or a couple of weeks with whatever happens.
I promise we're going to get to orthodontics.
Oh, it's all good. I love it all.
I promise we're going to get there. But you also seem like a really big relationship guy.
Yeah.
At least what you've been saying here, you've met people at the gym, your family, friends, you fly out, support your sister. And then you said, thinking about someone and sending them a text, it made me think about my friendships. So I didn't grow up here. I grew up just north of Salt Lake in Bountiful, Utah. And we moved to Houston, Texas, like back in 2007. And so we haven't lived back there for, 20 years. Moved to Houston, worked there for 6 or 7 years, and then moved here. And we've been here since 2014. So a lot of my childhood friends are still my best friends. And the thing that just pains me the most, and I've made really great friends along our moving journey. I've got great friends here. I've got good friends from Texas, and obviously my core group of friends from Utah. But I am, especially the more research I do on relationships and the important, even for men, to have men relationships and being able to talk to guys and all that kind of stuff. I feel like with family, and obviously it's the priority, and career and all this, I feel like those are relationships that are really important, but they get neglected a lot.
Yeah.
I'll think of a friend and I'm like, I should just text. If I think about him, I should just shoot him a text. It's so easy. And I'll be like, oh, I need to call him, or I need to do this. I'll do it later. I put it off. I had a friend of mine who's childhood, one of my all-time best friends. I could call him. I haven't talked to him in a long time. I could call him today and he'd do anything for me. I just know he would. He's one of those guys. And he called me last week and left me a voice message, and I haven't had a chance to call him back. And I'm sitting here thinking I need to freaking call him back, And so I would just love to get your thoughts on the importance of friendships, and if there's anything that you do to help keep those alive and cultivated and strong, knowing how important they are.
Yeah, I love this because it's a huge part, I think, of happiness too. So a couple things for me. I think part of the discipline and routine is I'm just a very routine driven person, and having time set aside and having a schedule for me is what allows me to maximize my day. So I plan out pretty much every hour of my day, which seems intense, but it works. And at the end of the day, then I feel like I've accomplished things instead of being like, oh, I missed this or that. And that happens too, though, right? I'm not perfect in that way. But part of my routine is on Monday nights, with one of our kids, we'll take them out to dinner, just one of them, and the other one stay at home. So we try and spend individual time. That's kind of our Monday night thing. Tuesday nights, my kids have sports, so I go and watch them play basketball, right? Mm-hmm. Wednesday nights, I'm involved in church stuff with my kids, which is great too. Opportunity to serve and give back and camaraderie, all that stuff too. Thursday nights are my nights for my relationships, actually, with my friends. Whether we get together or not, sometimes it's me phone calls. Sometimes it's me getting together with someone. Sometimes it's me to just sit down and write an email or a note. So I think for setting aside time for those relationships is really, really important. But it's also okay. Some relationships come and go. And I think that that's part of life. I mean, some of my relationships, as I've moved on and we've drifted apart with our ideals or our motivations, I think that's okay sometimes too. And in some friendships, there's one that is more of a giver and one that's a bit more of a taker. And I think we have to realize that too, and realize that some people may not recognize our greatness, or they may not value that. And I think it's okay to walk away from some of those relationships, because our time is so precious and life is so precious that we just don't have time for people that aren't going to be there to truly be in the relationship with us. And again, I think that morphs sometimes. I mean, I have friends that I've been super close with at some point, and we're just not as much anymore because our values and our our ideals have changed, and I'm always trying to level up, and you want your friends to level up with you. I mean, part of that is motivating, right? Mm-hmm. You doing this motivates me. Like, I want to be involved and be friends with someone like you because you're someone I want to be like. And I think that's really important too, because there's always times where you want to build up a buddy, right? If they're struggling, you want to build them up, but you also need friends that are going to build you up. And I think the most important thing for me in these relationships is my ability to have some cheerleaders in my life. You know, my wife is a huge cheerleader, but I'll be honest, for me, it's not that that's not enough, but I need some from friendships too. I need some of my buddies when I have a hard day or things aren't working right to say, dude, you got this. You're doing great. These are some ideas. This is what's great about you. And I think I thrive in that. I need it. And I love to give it too, because it feels good and it's genuine and real. So for me, setting aside a time for those friendships and is really important because I need them. And it's definitely quality over quantity. I mean, I don't have a bazillion friends that I connect and talk to. And again, it morphs. Some friends I'm closer with for a year or two, and it may change, but I get as much as I can from that relationship, and hopefully it sticks around and stays. But I think that, again, it's all about being vulnerable, authentic, real, especially us as guys. Like, we can't pretend that we put the mask on and, oh, we got it all figured out and we're making all this money and life is easy. It's like, no, let's talk about the hard stuff, right? What are you struggling in with your relationship with your wife or your kids? What's hard about fatherhood? Like, just talking about things and being real and open. You talked about Tide. Like, we had a little group of guys we met with. We would meet once a month and we'd talk about this stuff, like how can we be better dads? And we talk about business. We talk about faith. We talk about our struggles, you know, and a lot of that was good for me because it's like, we're not alone in that. We really aren't. I think as guys, we're getting better, way better with stuff like this. We're being more vulnerable. And I think that's super important. I want my kids to be able to do that, but we're not alone in it. And I think having those friendships allows us to, sometimes complain even, but also fill our cup a bit, fill their cup, but fill our cup at the same time so we can keep going for another week.
Yeah, no, that's super cool. Relationships are a biohack. I mean, it's a longevity biohack. Strong relationships do lead to happier, longer lives.
Yeah.
That is statistically proven. So relationships are important. And this actually reminded me of, I listen to Mel Robbins' podcast sometimes. And
Let them.
Yeah, she's so good. But she talked about friendships and people that struggle with adult friendships specifically. And, they come and go, and it's really hard to let go of some relationships, like you mentioned. And she kind of related it to trees. She's like, you have a tree and it has roots and has branches and it has leaves. You have some friends that are roots, like my buddy that called me. I know where I stand with that guy at any given time, even if I don't talk to him for years. I know where I stand with him. You've got those that are branches that are there for like really important times of your life, like big chapters in your life. They help you get through some really difficult times. They're there for you, but maybe over time you grow apart or your ideals change or whatever. And you still respect and love them, but you might just, would they be there for you on a whim? Maybe, maybe not, but they played a really important part of your life at a certain time. And then you have leaves. They kind of come and go, and you go up to Utah or somewhere in the fall and you see how beautiful the leaves are when they change colors and they all kind of fall off. And she made a comment about how you got to be grateful for them. Yeah. Like, even though sometimes it can be really hard when those friendships kind of fade and go, they played a really important part during that season of your life. Yeah. And just to be grateful for it, but also be okay with the fact that those leaves are going to change.
Yeah.
And so
that's so cool.
Anyway, I thought that was kind of cool. It just reminded me of that one.
Yeah. And I think they each need different types of nutrition for the food, right?
Sure.
One thing I'd left out is, my wife and I do date night every Friday, no matter what. I'm sure you do the same thing. Like, the most important relationships need the most food, right? Or nutrition and energy. But I think that's a really cool analogy. And I think it's true for us, but friendships and relationships in general, I love that. It's a total biohack. And I'd never thought of it that way, but I'm like, yeah, for sure.
For sure. Yeah. Well, cool, man. We can shift into dentistry now. Cause you're a wealth of knowledge there too. And so you and I, before we started chatting, we're kind of talking about some of the connections, between oral function, oral health, and how it can impact all sorts of different things within the human body. Specifically, I'm thinking adolescence. You probably deal with a lot of teenagers, I would assume, and maybe even little kids that come in. Maybe we'll start with, how early would you recommend that parents go see an orthodontist to check airway and all that kind of stuff?
Yeah.
Like what age is kind of the appropriate age to go do that?
Yeah. So we say at least by 7. And I think some parents at 11 or 12 feel guilty for not having brought their kid in at 7. It's all good, right? Yeah. It's never too late, but we like to see them by 7. And the reason for that is, some parents also think, well, they still have baby teeth. They haven't lost all their teeth yet. And it's like so true, right? But it's more than just like teeth and more than just straightening teeth. There's so much more we can do as orthodontists. And really what that comes down to is like we can really shape faces, but we have to see them young enough to do that. So if we want to maximize profile aesthetics, function, and health, which I think go together, typically things that look good function well. And the opposite's true too. So a lot of that starts with early development. So if there is some abnormality or habit or genetic predisposition to something, and we see the patient young enough, we can correct those things pretty amazingly. Whereas if we wait till they're 14, 15, 16, or even further when growth is either slowing down a lot or has ceased, we're left with compromising things, right? We're left with camouflaging skeletal issues, or we're left with using more invasive techniques. There's still lots we can do, but it's not as easy. So if we see them young, let's say that we have a patient that comes in and they're 7 years old, and we're noticing that there may potentially be some airway issues. And what we do at the practice is we have a huge, long kind of like airway checklist, right? We look at 3D scans. I measure the airway in 3 dimensions. I compare that to norms and averages for their age. That's been based on research and studies that have, for years and years, great peer-reviewed studies. And so we use that as well as some questionnaires with what's their behavior like, what's their sleep like, what habits do they have. And we're going to look at the growth of the jaws, like heights of jaws, lengths of jaws, widths of jaws at that age. We're going to look at tissues like tonsils, adenoids. We're going to look at the nose, the septum, the turbinates. And then we're going to really get into tongue too and look at tongue mobility, tongue restriction potentially. We really gather all those things together because they're going to control growth. And so not only they're going to improve the health of the patient, because obviously we're going to improve airway if it needs to be done. But if they have airway issues such as snoring, right? No kid should snore. If they have issues with their tongue, if they have issues with behavior, even ADHD. They did a study years ago that said 80% of kids with ADHD could effectively have their ADHD treated through airway solutions. I mean, that's crazy.
Have you seen that in your practice?
100%. I mean, I've had patients write me letters after doing airway treatment on how their kids' grades have improved, on how they've got their child back. I mean, it's emotional. These parents, they cry and they don't know what to do because unfortunately when they're young and they go to see their pediatrician, they don't really know what to look for. And it's not their fault, right? They're trained in different things. They're looking at body health, they're looking at organ health, and they do look at tongue sometimes. But if there's not a feeding issue, nothing needs to be done, right? It can kind of wait. But then by the time they're 7 or 8, they've then left with 6 or 7, or even if they come in at 10 or 12, right? That's a decade of life now with poor growth, poor posture, poor development that they've kind of missed out on. And so if we can see them earlier and correct those things, their life gets better sooner. And again, we can correct things even later, but I think there's so much importance in doing things early because then they're going to live a better life too, even when they're young, and we can reverse some of those things and just help them grow better, which is going to look better, which is going to give them more confidence. It's going to help with the bite. They say a lot of times we see like big overbites and underbites is not necessarily a genetic thing, which it can be, but even more of a sequelae of an underlying growth issue that could be airway related, tongue related. So if we can really attack those things young, then orthodontic treatment is easier, right? The aesthetics of things are easier. Their oral health is easier. Their function is better. And the whole, I mean, I don't want to torture kids with all these crazy things, but if I can modify growth early, it's very simple things too, things that are very minimally invasive, expansion, right? Bringing upper jaws forward, lower jaws forward. These things are not hard to do when they're young. It's very easy for kids. It's not painful, but it can make a huge lasting impact because doing those things at our age, it sucks, right? No adult wants to go through crazy things like that. We want to have it done when we're young. And really my goal is let's get kids in really good health and function and aesthetics before they go to high school. That's really the goal. If we can finish all this by 8th grade, that's my goal. Because then it's like, boom, they can go live the rest of their life and enjoy the health and function and aesthetics. And, we have a lot of patients too that like they're adults and they had braces when they were younger. There's a lot more we can do now. But also, right, they lose their retainers and blah, blah, blah. So we try and get smart with that too, where we offer like a lifetime retainer program where anytime throughout their whole life they need new retainers, we just give it to them. It's included in their treatment because I want it to be lifetime. And a lot of what we do even as kids is we're predicting their growth and looking at these things to say, okay, I want your face and smile to look good, not just when you're in high school, but when you're 50, 60, I want you to age better. So again, there's so much that we can do, but it's about being involved with it a little bit. And again, it's not rocket science stuff. It's pretty easy things, but seeing them young can really help us to get things taken, under control earlier to provide better outcomes long-term.
Has the kids' mouths over time changed?
Yeah.
If so, how?
Yeah, I think with our diets, we all know like our diets suck, right? All of us know that. And so there's consequences in every part of our body because of that. Back in the day, you think even caveman, right? We have wisdom teeth. It's like, why do we have wisdom teeth? Well, guess what? They used those. Their gnathology is like the study of jaws, and jaws were a lot bigger during, hunter-gatherer times. They were eating tougher foods. Our diets are softer now. We're not eating the harder, tougher foods. We're lazy, right? In most areas of life because convenience has become the motivator. It's money driven and convenience driven. So jaws have gotten smaller. And because of that, if jaws are smaller, airways are smaller. And so all that goes in hand. And if we see that there's a patient that has airway issues, well, typically they have a small mouth with a ton of crowding, right? So you solve one thing that is going to then benefit all the other areas. But certainly I'm seeing, even throughout my career, the last 10 years, I'm seeing more prevalence of airway issues than I did even when I started. And I'm looking for it more now too, for sure. Mm-hmm. And a lot more research has been done. I did all my airway studies at Stanford, and there's still, unfortunately, a lot of practitioners that aren't versed in this. It's not they don't believe in it. I think they just don't take charge in it. But I definitely see it as our responsibility.
Okay. So the airway problem is just getting worse with food. It could change over time and go back the other way. I think there's a huge health initiative right now going on. And I think we hit I'm an 80s baby. So, we hit all the fun manufactured foods that were really easy and soft, and we got the packets. So you don't have to chew on anything. So what are some of the biggest symptoms of airway issues in kids?
Yeah, so definitely behavioral issues. So, difficulties focusing and concentrating, ADHD, right, which is huge thing right now. Definitely like bedwetting even. We call nocturnal uresis. Bedwetting can be a problem. Scleral show, darkness under the eyes, difficulty with attention, even things like, you can see it. If you see a kid, when you watch your kid at night, for anybody watching, it's like, does my kid have an airway issue, right? Look at how they're sleeping. They should sleep with their mouth closed, in and out through their nose, with a normal up and down of the chest. If you hear snoring, if you're stopping of breathing, if mouth is open, and if they're kind of making funny movements or noises, that's typically an indicator that something's not great. So watch your kid when they're sleeping. It's not like you have to sit there with the camera, right? But just checking in on your kids. Let's say over the next week, check on your kid one time, check on all 5 of your kiddos this week, see how they do sleeping, right? And then knowing if you have any sleep issues or grandpa has sleep issues, there are some genetic components of this too. But really a lot of it comes down to our evaluation too. But there's a list of so many comorbidities with heart disease and all these different things, a lot of cardiac issues for sure that can come from airway issues. And it makes sense, right? It's like we need oxygen for our brains to grow and develop well, as well as the rest of our body and organs. It all starts with the airway. So if we don't have good patent airways, and really the goal is good patent nasal breathing. If good patent nasal breathing is occurring, especially at nighttime, the jaws are going to grow the right way. If we're not breathing well, mouth breathing, nasal breathing is suffering, our jaws grow more downward and they grow more vertically, which exacerbates the airway issue. We want things to grow forward. It looks better. It's going to stand up the time of time. We're going to look better longer, right? Aging wise, it's all about fullness. But if we're growing vertical, we're growing almost backwards. And so the airway issue just gets worse and worse and worse until it's intervened, either with something surgical, something orthodontic, appliances. There's lots of ways to attack these things, but catching it at its root cause when they're young is just so much easier.
So that was going to be my next question, is if you have a 7-year-old that's sleeping with their mouth open and making snoring sounds, and you check them and they do have airway restriction, how would you treat them?
And there's three big things we're going to look at. So I mentioned kind of like height, length, and width of jaws. So if there's an issue with one of those three things, let's say, for example, that the width of the upper arch is really narrow, it may just be that we need some expansion, right? With like a palate expander. You've probably heard of that before. If you think of the top of the mouth as the bottom of the nose, as we expand the arch skeletally, we're actually growing new bone between a suture that is between our two front teeth. It's what we call the mid-palatal suture. Because they're young and growing, we can open that suture, create more volume, and the arch in the top of the mouth is the bottom of the nose. So it's going to stretch the airway kind of like a balloon. So that's one thing we'd be looking at. Now, if their jaws are too far set back, there are things we can do to bring jaws forward. We can do appliances at nighttime that they wear with some elastics to make the upper jaw grow forward or the lower jaw grow forward. Now, we attack these at different times depending on their growth stage. Upper jaw issues typically treated younger, lower jaw issues typically treated a little later, depending on where the patient is in their growth status. So we look at that, we develop a plan that maybe, and a lot of this only takes us about 6 months. It's not like we're doing this for 6 years or 10 years, but we really like to partner with patients and their families over like a 10-year period. If I see a kid at 7, I'm going to say, hey, we're going to work with you for the next 10 years. It doesn't mean it's going to cost you $1 bazillion, right? But I want to see that kid every 6 months. It may just be me checking and looking at growth and planning growth to make sure it's going the right way with little interventions potentially along the way that are relatively inexpensive and may only take us 6 months to get them back on track. And then we just keep watching and waiting. And then usually when we do that, the orthodontic stage is pretty simple because now aesthetics are good, function is good. Now we're just perfecting things with their smile, which is a whole nother side I'd love to talk about, right? With the veneers and all that. I'd love to get into that too. But so one thing we'd look at, right, is looking at jaw growth and making adjustments to jaw growth if needed. Right. And that typically needs to happen before about age 15 or 16. Girls tend to stop growing about 16. Boys, we can grow into our 20s sometimes, but we like to do that intervention pretty young. So that's number one, is just growth of jaws. Second would be looking at tissues. So tonsils, adenoids, looking at the nose and all that. And sometimes we have to send to ENT for tonsillectomy or, allergy meds, something like that. And then finally, we're looking at tongue position, tongue posture. So if their tongue is inhibited, I'll do a tongue release potentially if they have like a tongue tie. We'll work with like mild functional therapy to get the tongue in the right position to help with growth there. So it really just depends on their issues, but we do a kind of a holistic approach to look really at those big three things. And sometimes it's just one that they need. Usually it's just one of them. Sometimes it's two. Rarely it's three. It depends on the severity of the airway issue, which is funny too. So if a kid has all three of those problems, typically their airway is really bad. And I see that often. If they have just one issue, maybe mild, right? And it's easier to fix. But we don't know unless we see them. So if there are kids struggling with that, let us come take a peek and at least get it checked.
Yeah. Oh, well, that's cool, man. There's so much there. I think, given probably the audience a pretty good guide as far as like checking out their kids and, and not being nervous to take them in too early. I think I don't know, maybe it's just from the way I was raised and just the timing that you'd go see an orthodontist. It wasn't until you were like a teenager. I felt like it was like time for braces, go see the orthodontist. But I think the message, at least now and maybe in more functional medicine, is it's like, no, go earlier, get them checked out. There might be nothing.
Yes.
But
and that's the hope.
That's the hope, right? You go early, check it out. And that's what we're trying to do just in functional medicine in general, is be more preventative instead of reactive.
Amen.
Yeah.
That's it. And I'll be honest, I'm pretty conservative even with that approach with early treatment. And I would still say 75% of the kids, like, they don't need a lot. And that's great. Like, that's my hope, right? It's, hey, you don't need anything now. We're going to keep tracking you every 6 months till you're ready for braces. And it's a pretty easy process. But for those kids that do need help having the early intervention, if it's 25% of those patients, which it's about that, the early intervention is so important. And it's going to give you peace of mind as dad to say, hey, we checked that off the list. The kids are good, or there's one kid that needs some intervention that's small, and then it's going to make our life and that kid's life a lot easier down the road.
Well, and early childhood development is so important. And I think parents really care about it. Yeah. I think sometimes these sorts of topics aren't really discussed a lot. And so they think they're doing everything right, but they see behavioral issues in their kid. They might see them lacking in school, hormonal development, and all this stuff can be tied to the mouth. So there's lots of other things it could be too. But again, kind of taking that preventative approach and saying, well, let's just go because it's all connected. Our whole system is connected. And there's so many like the neurological side of like your jaw and all that and the impact it could have. You talked about cardiovascular and the impact it could have there, and all that's going to impact on everything else, your cortisol levels, your hormone development. So it's all connected. And so my thought is just go get them checked. Just get a checkup.
Random thing with that is when I was in residency, I did a study on power clean. So I used different mouth guards and different mouthpieces and looked at that with a PR for power clean. And those that fit the best and function the best as far as mouth guards affected the PR, which is what they call it, the spillover effect. So you load the muscles right or the joints right. There's a spillover effect in the rest of the body, which is so interesting. Yeah. It's crazy.
Yeah. Well, and I think, so you want to talk about veneers, which I would love to. Maybe before we jump to that, because this is related, is maybe more into adulthood. Sleep apnea has become kind of a big thing too, especially as you look at like heart disease and early death tied to a lot of that as well. So there's been a lot of technological advances in this. I know there's probably a lot of men out there that do not want to wear one of those CPAP machines and, the Darth Vader machine at night and all that kind of stuff. Is there anything that's been developed that you would highly recommend be used for people that are snoring? And a lot of dudes, myself included, don't want to admit that they might snore. Yeah. My wife might tell me, or she'll nudge me at night and I feel stupid. And I'm just like, I don't snore. She's like, I'm telling you did. I'm like, just kick me out of the bed then, because I feel so bad. Yeah. But, I think there's also kind of the ego side. There's some people that have it so extreme that they're stopped breathing like really bad. But then there's early signs of sleep apnea. What are you guys doing for sleep apnea patients? And what are some cool, like, new technological things that people should look into?
Yep. And so let's say you missed the boat, right? Your parents didn't know. We didn't know well enough as orthodontists 20 years ago. And now here you are as an adult male or female, and you find yourself with airway issues and you're struggling, whether you have apnea or not. The gold standard really is to get a sleep study to check that. They get something called an AHI, which is a hypopnea index, which will tell them how their breathing's doing at nighttime, how many times they're stopping to breathe. And there's different mild, moderate, severes. But if someone does have sleep apnea, there's about 5 different things I would potentially recommend depending on the severity of it. So we come in, we do the same questionnaire, same evaluation, look at history, look at health in general, comorbidities, things like that. If it's really severe, sometimes we'll recommend jaw surgery. I don't do that often, but if it's really severe and it's affecting their quality and quantity of life, we can add years on their life, years of healthy quality life. And yes, jaw surgery sucks, and I don't recommend that to everybody for sure. But if you're a high risk, or if you have severe sleep apnea, it's going to affect you. You're going to have issues down the road. So sometimes it's surgery where we bring both the jaws forward. And that's about a 6-week recovery. It's not, and a lot of times insurance even will cover that. So that's kind of number one, which would be probably the most intense and invasive. Just underneath that, which I probably would say most patients do, is expansion in adults. So we call this a MARPE, which is mini screw assisted rapid palatal expansion. So a lot of it, again, deals with the length and width of jaws. And one thing we can do that's kind of about 10 or 15 years old is we utilize these little mini screws, and we use those to help move the bones and do some orthopedic changes, even in patients that are no longer growing. So for example, if a patient's palate is too narrow and obviously their throat is too narrow and their airway is compromised because of that, the suture I talked about starts to fuse 16, 17 years old. So what we do is I put an expander in, and with that expander, I put a couple mini screws in the roof of the mouth. Seems intense. It's really not. I do it under local anesthesia, no sedation. It's like getting a filling, right? They're sore for about 5 days, but we actually open that suture. We kind of break it open and we grow new bone in that area, and we do it the same as we would a kid. But instead of them having to go under surgery, which is what we would used to do for this, we can really solve a ton of airway issues with just this expansion. Even about 2 weeks into this, people are breathing and sleeping better. Of course, we're going to redo all our measurements. I just took one of these out on a patient yesterday. He started with an airway volume of 80 millimeters squared, which is about moderate as far as risk is going, but he had a ton of severe symptoms. We took his MARPE out yesterday. I re-measured airway. It was 260, and his inner arch width went from 40 millimeters to 57. So, there's some amazing things we can do. So that's probably the most common thing that I will do for patients. And that involves braces as well, because you're going to get space, right? You're going to get space interdental between the teeth. So typically we'll do braces or aligners in conjunction with this appliance. It usually takes about a year start to finish. So that's kind of the second big. That's probably the newest and hottest thing that everyone is doing, is this mini screw technique.
Is there a cosmetic effect to that?
For sure.
What I mean, if you expand your jaw, is my face going to look different?
A little bit. So, and part of that's aesthetic too, is like people want bigger smiles. If someone has airway issues, typically their smile's really narrow, and you're only going to see like 6 teeth when they smile. But part of this for sure is like, I'm looking at the aesthetics as much as I am the function. But again, they go hand in hand. I like big full smiles. I want to see 14 teeth when you smile. So part of having that expansion is not only going to benefit them from a health perspective, it's going to look better. They're going to have a bigger, wider smile. So that's kind of the second thing. The third thing under that would be just normal orthodontics. There's two types of expansion. One is skeletal expansion. The other is dental expansion. If teeth are really tipped inward, tongue space can be compromised. So a lot of times we're just uprighting teeth and trying to get more tongue space, more mild in its benefits, I would say. But for people that have mild symptoms, that may be enough. And then last kind of result there is these appliances, right? It would be a CPAP, for example. If patients can't tolerate a CPAP, we use what we call mandibular repositioning appliances, or like a snore appliance. It basically is a little appliance that goes in the mouth that puts people into like a little underbite, just while they sleep to open the airway passage. They just wear it at night. They take it off in the morning. Again, more mild with its benefits, not as good as a positive pressure machine like a CPAP, but it's better than nothing. If you can't tolerate the CPAP, it's better than nothing. It's probably, again, the thing I recommend the least, but for someone that can't go through orthodontics or MARPE or surgery, it's certainly better than nothing.
Cool. Now that's good. I think those are all really good, good explanation of what you can do. I think there's a ton of people that suffer with it, and there's massive health ramifications if you have poor sleep, first of all, and second of all, if you're not breathing while you're sleeping, you're going to reduce years on your life for sure. There's a ton of heart disease studies tied to that. So, all right, veneers. You wanted to bring up veneers. Love to hear.
That's just another thing that I'm really passionate. So we've created these 10 features that we call the Nichols smile, and it goes anywhere from and I'll kind of go through them briefly, but it involves with first looking at the faces and maximizing profiles, right? Lip support, all that, to the width of the smile, to the position of the front teeth with midlines, but also vertically, like how much gum tissue they show when they smile, but making sure they show enough of their teeth to make it a youthful smile. To, again, shaping the teeth is something I really like, in shaping the gums. So those are two things I think that are kind of unique. And from a wellness perspective, with this new generation of wellness, which I think is amazing, there's a lot that can be done naturally too to make patients' teeth look like veneers. And it's something I really love. So for people that don't have the best shaped teeth, I don't want them to think that the only option is for them to go and have their teeth, some enamel removed and porcelain placed that they have to have replaced every 10 years. Now I'm saying there's a place for that too. If they have broken teeth, or their teeth they have big fillings or chips or whatever it may be, like there's a great place for that, and great cosmetic dentists that do good work that will hold up the test of time. But there's a lot we can do naturally too, to shape the teeth to make them look like natural veneers. And then the maintenance of that is so much lower. But I think people don't know that. And I kind of want, if I'm being honest, I kind of want to be like the natural veneer guy. And the reason for that is I think it will open people's minds to be like, hey, if I can undergo 6 or 12 months of orthodontics, I can get a natural veneer look without having to do any of those more invasive techniques that will then stand the test of time forever. All they have to do then is whiten and wear their retainers. That's it. And their smile will look legit and natural and healthy, and they won't have to spend a ton of money. It's cheaper too, right? It's maybe half the price or a third of the price.
I've actually never even heard of natural veneers.
So if you look on my Instagram at Dr. Trevor Nichols, you'll see pictures, right, before and afters with teeth that are not shaped great, and after, and people almost don't even believe it. They're like, how are these are the same teeth? Oh, well, you added veneers or you added filling materials. Like, no, we shape the teeth, the fronts, the backs, the sides, the edges. There's so much we can do to shape teeth along the root, because we can move them. So I can shape a side of a tooth and close the space, or I can shape the edge of a tooth and move it down. We have so much ability and control there to move things. And then at the end, I can shape the gums to make the tooth the right shape and size too. It's awesome.
Well, yeah, man, I seriously, like, you're a wealth of knowledge. It's been cool talking to you about all this kind of stuff. And I'm sure we can keep talking more. I'll probably want to have you come back in again if you'd be open to it.
Always.
But, you know, being the Generational Health Podcast, we always try to focus on the impact that we're making on our kids, the next generation. Is there any message that you'd have for the next generation? So as you think about the stuff we talked about today, you know, kind of your routine, the example you're leaving for your kids, your profession, some of the ups and downs and challenges of going through building your own company, what kind of advice would you have for that next generation?
I love that. And first, I want to thank you for this. I know it takes a ton of your time and you're just looking to give back. There's no personal gain you're looking for here. I know that and feel that from you, and you're helping people, you're changing lives. And I think that's huge. And I don't think people realize the effort that goes into that.
I appreciate that.
But I would say, for the younger generation, it's like, don't be passive with your health. And also be careful what you read into, I would say, right? We need to look at what is actually working. There's some voodoo stuff, and I'm all up for trying things that have low risk for sure. Like I told you that my sibling Chinese medicine, like I'm all for that, right? And trying those things, but also, look at it from a research perspective, right? Don't just listen and believe everything you hear. So be passive. Don't be passive. Like take charge of your health, but do it in a smart way. And then I think too, as far as, again, find your passion. You have to experiment in life, try new things, go and explore the world, be out in nature, get away if you can from the phones and the TVs and all that. And we all fall traps to that, but get out and experience life, because you'll find what is going to bring you happiness. But if you don't go outside the door to do that, you're never going to find it. But always remembering that the best part of wealth is health and relationships, and we can't sacrifice those for other means.
That's awesome, man. So thanks for sharing that. If people want to get in touch with you or find your clinic, what's the best place to find you?
Yeah, thanks for asking. NicholsOrtho.com. We're in Quinn Creek by Quinn Creek Marketplace is where the office is. And my Instagram's at Dr. Trevor Nichols. I'm really good at responding to DMs. Hit me up. Happy to answer questions, offer advice, anything like that.
And it seems like you do a lot of training too for other orthodontists as well. So I think going to your website or your Instagram would be really good for other people in this profession to learn and see some of that stuff you're doing too. So
awesome. Thanks,
cool.
Bobby.
Thanks for coming in, man. Appreciate it.
Appreciate it. Thanks for listening.